So far, we've spoken about PID in general, and we've established that acute PID is normally caused by sexually transmitted infections. And now we're going to go on to discuss the pathophysiology of PID in a little bit more depth. So PID is a polymicrobial infection in most cases. So although I'm going to tell you now about certain organisms that are commonly involved in PID, there's usually a whole host of other organisms that co-infect along with these organisms, and in some cases the cause is not identified. Let me start by telling you about a few of the more well understood organisms, and then we'll go on and speak a little bit more about pathophysiology. So the first organism I want to tell you about is Neisseria gonorrhea. It's colloquially known as the clap, and that actually comes from the French word clapier, which means brothel. So that's where the meaning of Neisseria gonorrhea's nickname comes from. It is treated with ceftriaxone. I've just written that here from the beginning so that you can start to remember the treatment for Neisseria gonorrhea. 15% of women who are infected with gonorrhea go on to get PID, which means that the majority of women who are infected with gonorrhea will never have pelvic inflammatory disease. They'll just have cervicitis, vaginal discharge syndrome, but they'll never have ascending infection. Women who have gonorrhea-associated PID tend to have a severe course of their infection. It's rapid, it's very noticeable to them. They go to hospital quickly. They tend to get treated pretty quickly for it because it's so severe. Let me move on to the next organism, which is Chlamydia trachomatis. And that is known as the clam. That's its nickname. And we treat it with azithromycin. So, similar to gonorrhea, 10 to 15% of women who have vaginal or cervical infection with chlamydia go on to get PID, which also means the majority of them will not get PID. With chlamydia, there's more likely to be a subclinical chronic course that can lead to tubal damage and pain, but is never formally diagnosed as PID, or only diagnosed months or years after contracting it. Then another organism that new research is showing is often involved with PID is Mycoplasma genitalium. And anaerobes are also often causative agents in PID. So these organisms here are known as primary invaders. They are most likely to cause PID shortly after menses, after the insertion of an IUD, after uterine curettage, or any other procedure that breaches the endocervical canal. There are other primary organisms, but these are some of the most common and some of the most well understood. These primary invaders ascend up the endocervical canal. They damage the tissue in the upper genital tract, and they allow for further infection with secondary invaders. So some examples of secondary invaders are E. coli, Strep faecalis, or other anaerobes. And these can be organisms that are part of the normal bowel flora or normal vaginal flora. They ascend the damaged endocervical tract, and they worsen the infection in the upper genital tract. So what are the acute results, the acute effects of infection with these primary and secondary invaders? Well, it starts with endometritis and salpingitis. So you can see here, this is a picture, this is demonstrating early salpingitis. There's some inflammation in the center of the tube, and at this point the woman may have a little bit of tenderness and possibly a discharge. What happens after that? The inflammation and swelling in the tube worsens and spreads to involve more of the tube. This is late salpingitis over here. after that, the tubes become occluded due to the swelling, pus begins to accumulate in the tubes, adhesions begin to form, and here we've got, this is a tubo-ovarian complex forming over here. So you can see that there's pus accumulated. At this point, the woman's in a lot of pain. And then what happens next from there? The tubo-ovarian complex can rupture, and at this point, there's going to be generalized peritonitis because pus is spreading throughout the abdomen. So this is just a visual representation of what might be happening in the tubes, and it can happen bilaterally. I've shown it just happening on the one side, but it can also happen bilaterally.